one of the big problems we have is that we don't have the answer to everything. Let me just choose hypertension as an example. We've never had absolutely irrefutable evidence that a particular blood pressure target is the optimal target for preventing major events. 140/90 is something that we all know seems to be a good target. Do you know, it's never been studied. No one has ever done a clinical trial to show you're better off less than 140 or more than 140. There's plenty of observational data that we cull from all sorts of other clinical trials with all sorts of other agendas and said, oh, by the way, did you notice how the people less than 140/90 seem to do better than the people more than 140/90? But that really doesn't quite fit the NIH definition of evidence, which is why it's really important for groups like the American Diabetes Association, the National Kidney Foundation, the American Society of Hypertension, the specialty groups to weigh in with their considered opinions. They're not as authoritative as the NIH, which is very much evidence-based and therefore has to be very cautious in what they say. But when you have a group of diabetes experts at the ADA or a group of kidney experts at the National Kidney Foundation or a group of hypertension experts at the American Society of Hypertension saying, we believe this is what you should be doing even if we don't have the absolute convincing evidence, to me that's very important, and that really serves as a great adjunct to what the NIH is doing. So taking it all together, I think physicians are getting some pretty good background to help them decide what to do for their patients.
You know, I was looking at all this. There are some astounding numbers. Previous studies have shown that a 1-point increase in BMI results in a 4% and 7% increase in medical and drug costs, respectively. Furthermore, a 5% weight loss results in a 55% lower risk of diabetes in high-risk individuals and a 49% reduction in anti-diabetic medication dose. So, Dr. Weber, what are the downstream effects of BMI reduction and weight loss on cardiovascular health and outcomes?
You know, it's very difficult to know whether managing obesity effectively will give the results that we would hope to see. And the reason is we have not had really definitive obesity clinical trials. People who've developed obesity drugs have shown that they can reduce body weight for a certain period of time, at least while people are taking those particular medications. But they've never had data to show that by doing that reduction in weight, that they also were able to reduce strokes or heart attacks or other events. Unfortunately, because the drugs that were being used for reducing the body weight might have had deleterious effects that, despite the weight going down, might not have allowed a reduction in strokes, heart attacks, and other major outcomes. And unfortunately, losing weight by dietary counseling and so forth, wonderful though it can be, and helpful though it is for some people, is rarely maintained for that 3, 4, 5, 10-year period that you need if you're going to study major outcomes. So if you ask me, what is the evidence that reducing body mass index, reducing weight, keeps you alive longer or prevents you from having strokes or heart attacks, I'd have to say, you know, there really isn't much evidence. I think it probably is a good thing to do, and I try my best to do it with my patients, but I can't say for certain that it is the best strategy.